Ever wondered why you've got smoker's lines, even if you've never touched a cigarette? The fact is, vertical lip lines aren't just caused by smoking. I see this issue every day in my UK aesthetics clinics. And once they're there, they can feel impossible to ignore. But there's good news. So in this video, I'm going to show you why vertical lip lines appear, even if you don't smoke, which treatments genuinely work from skincare to lasers, and when to consider clinic-based options if you're not seeing the results you hope for in time. But if you've ever looked in the mirror and felt frustrated by those little lines, let me show you what's really going on and what you can do about it. So let's start by clarifying what the lines are. Vertical lip lines are the little creases that form between your nose and upper lip. They typically start in the center and can spread outwards depending on your unique facial structure, daily habits, and even how expressive you are. At first, these lines are faint and barely noticeable. Over time, they become deeper and more pronounced, especially as your skin naturally becomes thinner and less firm. And here's the real issue. For most women, men don't usually get them. These tiny lines just aren't a sign of looking older. They can completely change how you feel about, for example, wearing lipstick, how confident you feel in close-up photos, or even how freely you smile. Although the lines aren't a sign of serious disease, they can be really frustrating, especially when they appear earlier than you expect. So why exactly does this happen? It's not just aging, though that's definitely part of the picture. The lines form from a combination of changes in your skin, your muscles, and your environment. First, as we age, our skin loses collagen and elastin. Collagen is like scaffolding, it holds everything up. And elastin is your bounce-back elastic protein. Without them, the skin thins, dries out, and becomes less resilient. Second, the ring muscle around your mouth starts to overpower the soft tissue. Imagine folding a piece of paper again and again in the same place. Eventually, the crease becomes permanent, and that's what's happening above your lips. Then you've got external factors. Sun exposure is one of the biggest culprits as usual. UV light breaks down collagen and speeds up wrinkling. Smoking is a real double whammy. You've got chemical damage with lack of oxygen coupled with constant lip pursing. And finally, genetics. Some people just are more prone to early wrinkles around the mouth, regardless of lifestyle. So if you've been wondering why these lines appeared, even though you do everything right, now you know. Next, I'm going to show you what actually helps. Let's start with home treatments, what you can realistically do on your own. And we can begin with what the research supports. First of all, topical retinoids. These are vitamin A-based creams. They help boost collagen production and accelerate skin turnover. In long-term studies, they've been shown to reduce fine lines by up to 40% over 6 months for people who comply with the treatment. You've got to begin with a low concentration, 0.25%, to help your skin adapt. Once tolerated, you can gradually increase to higher strengths like 1%. You've got to make sure your skin is completely dry before applying retinol. As damp skin increases absorption and irritation. You can also use a light moisturizer before applying if you've got sensitive skin, and that buffering technique reduces potential irritation. Start with every third night for the first 2 weeks, and if your skin tolerates it, you can increase to every other night, then nightly. Then we've got antioxidants. These are serums containing vitamin C and E. These brighten the skin, they reduce hyperpigmentation, also boost collagen production, and protect against environmental damage due to their antioxidant properties. This means they mop up the free radicals that damage the skin internally. Choose a product with a concentration of about 5 to 10% if you're new. Higher strengths can still be irritating. Apply it in the morning after cleansing and before moisturizing to maximize the antioxidant protection throughout the day. Start with a pea-sized amount. Use it every other day, gradually increasing to daily use as your skin adapts. Always follow with sunscreen, as vitamin C can make your skin more sensitive to UV exposure. Then you have hydrating moisturizers. Ingredients like hyaluronic acid, these draw water into the skin. They won't correct deep lines, but they do improve the overall texture and reduce that puckered look. For oral collagen supplements, there's a growing evidence base to show that they actually work. Trials show that hydrolyzed collagen can reduce fine wrinkle depth by about 10, maybe 20%, particularly around the eyes and the mouth. You should use a dose of about 10 grams per day for maximum effect seen over 12 weeks at least. Sun protection is really important and non-negotiable, probably the single biggest thing you can do for your skin. I'd say use a dedicated SPF balm, as the area is often missed when applying cream. SPF also helps reduce irritation from the retinol creams. I'd suggest that a dedicated lip balm is ideal, as the area is often missed when applying cream, and it also helps reduce irritation from retinol creams. Lifestyle tweaks are crucial too. Stop smoking if it's applicable, one of the most powerful changes you can make for your health overall. Although hydration is important, I'd suggest trying to avoid drinking from straws or narrow bottles throughout the day if you can. I know there's a craze in the US for the Stanley Cup, which means a lot of people are doing this. A dermatology study showed that frequent straw users develop lip lines about 20% earlier than non-users. Still, stay hydrated and maintain a diet which has got lots of antioxidants in green leafy vegetables. If you're doing these things already, you still feel the lines bothering you, then perhaps this is where the clinic-based treatments might offer a more significant and targeted solution. So when your lines are starting to feel etched in or visible at rest, clinic-based treatments can really shift the dial. So let's walk through each option, because the key is understanding what they do and when they're best used. So dermal fillers are injectable gels, often based on hyaluronic acid. It's a molecule already in your skin. It attracts water. For vertical lip lines, I use a specific type of filler, small particles, very soft HA fillers. Why? Because large particle fillers can look bulky or stiff in this delicate area. One large randomized trial showed that over 80% of people treated with the HA filler with the vertical lip lines had significant improvement by week 8, compared to just 8% in the placebo group. And 2/3 of those lasted over a year. The technique matters too. We're no longer filling in every line. That can look really unnatural. Instead, we're restoring lost structure in the lip, gently lifting the area and letting the skin drape more smoothly with tiny stripes of filler in the skin above the lip. That's called the ergotrid. Next up is Botox. This very effective and famous chemical relaxes tiny muscle fibers around the mouth that cause lines through repetitive motion. Think of it as switching off the crease maker. One study that looked at Botox around the mouth saw that 72% of patients saw visible improvement in lip lines, even when used alone. What's even more impressive is when Botox was used before resurfacing treatments like lasers or peels, results improved even further. It's about synergy, so you calm the muscle and rebuild the skin. And to be clear, stopping Botox doesn't make the lines worse. You simply return to where you started. So with laser resurfacing, CO2 laser is the gold standard for deep, stubborn lines. It works by creating tiny controlled injuries in the skin, which sounds concerning, but triggers the body to lay down fresh collagen and elastin. One landmark study that looked at CO2 laser against deep chemical peels found that both helped, but the CO2 laser was slightly superior, especially around the lips. Even 1 to 2 sessions can significantly smooth deeply etched wrinkles. Though the downtime can be considerable, you can expect redness and peeling for 7 to 10 days. Newer fractional CO2 lasers offer similar results with less recovery, still powerful but a little kinder. With radiofrequency microneedling, I use Morpheus 8, but there are many good brands. There's Silfirm and Secret RF. This is one of my favorite tools, especially for moderate cases. Here's why. It uses microneedles to deliver heat deep into the skin, stimulating collagen and tightening the skin from below. Recent studies found that RF microneedling improved skin firmness by about 30 to 35%, with a notable reduction in lip lines after 3 sessions. A 2022 comparison study found that RF microneedling gave better results for perioral wrinkles than fractional lasers, and with much less downtime. So if that's confirmed in future studies, it makes RF microneedling one of the treatments of choice. It's especially good when paired with PRP, that's platelet-rich plasma. So PRP involves drawing a small amount of your blood, spinning it to extract the platelets, and then injecting the concentrated growth factors into the skin. You can think of it as your body's own healing boost. On its own, PRP delivers subtle softening, but when combined with microneedling or laser, it shines. One clinical review showed that 85% of people saw an improvement in fine lip lines after a series of PRP treatments, and satisfaction scores are very high. It's especially appealing if you want a regenerative, natural approach. So combination treatments is really where the magic happens. By blending techniques like Botox with filler, with RF microneedling with PRP, we can tackle movement, volume, structure, and collagen all in one plan. Each layer adds another benefit, and the end result is more natural, durable, and more elegant. It's not about looking frozen or puffy, it's about restoring harmony. These treatments remind me of one of my favorite patients. Her name's Margaret. She's 64, retired from nursing, and one of those people who lights up a room. So she came to see me, and it was after a bit of a long gap. She wasn't smiling as much, so her lipstick, which she loved, had started bleeding into the lines above her lip. I just feel less like myself, she said. So she wasn't looking for dramatic changes. She wanted to feel confident wearing colour again. So this is what we did. We started with low-dose Botox, just enough to soften the movement but not freeze it or cause functional difficulties. Then a tiny amount of soft HA filler to support the lip border, not plump it. And finally, radiofrequency microneedling, that's Morpheus 8, to rebuild the collagen gradually. With collagen treatments, you can't rush, but do one step at a time. And after a couple of months, she came back wearing her red lipstick confidently. And that's the power of thoughtful, layered treatment. It's not just about smoothing lines, but about restoring identity and bringing confidence back. Now I want to drive home a key point. No single treatment, no matter how good, is a magic wand, but when you combine them strategically, you get results that are more effective, longer lasting, and far more natural. A 2023 study found that combination treatments outperformed solo treatments in over 90% of cases, especially in complex areas like the upper lip. It's like renovating a house. You wouldn't just paint the walls if the structure was crumbling underneath. You'd fix the foundation, replaster the walls, and then paint. So that's what we're doing with vertical lip lines, supporting muscle, replenishing volume, rebuilding collagen, and enhancing healing.
So let's keep it simple. There are 3 levels: mild, moderate and severe, and each one needs its own approach. Let's start with mild lines. These are faint, early wrinkles, maybe only visible when you stretch the skin or wear lipstick. At this stage, it's about prevention and collagen stimulation, daily SPF on the lips and the face, a good antioxidant serum in the morning, and a retinoid at night. Hyaluronic acid topically to hydrate and plump the area, and oral collagen supplements. Well, now we know that several trials support their role in maintaining skin elasticity, and if you're expressive or a straw drinker, a tiny bit of Botox every few months can help stop those lines from getting deeper. With moderate lines, these are visible even at rest, so you'll want everything from the mild plan, but adding in some clinic treatments. Botox becomes a standard treatment every 3 to 4 months to reduce muscle tension. We might introduce a soft filler, just enough to support the lip area but not inflate it. And then collagen stimulation, importantly. Radiofrequency microneedling like Morpheus 8 is fantastic, usually 3 sessions spaced about 4 to 6 weeks apart. And if you want to boost your glow and results, you can combine that with PRP. Finally, severe lines. These are deeply etched and often very visible even with makeup. Here we go layered and strategic. Start with Botox and a supportive filler base, then bring in laser resurfacing, ideally CO2 laser to smooth and retexture the skin. Between or after those sessions, we might use RF microneedling to sustain the collagen response. PRP absolutely accelerates recovery and adds further rejuvenation. And of course, you can continue your home skincare throughout. So now you understand why these lines appear, what actually works to treat them, and how to choose the right combination of treatments for your stage. But here's the thing, lip lines are just one part of facial aging. Often they appear alongside something else that quietly changes how we look and feel. Jowls, that softening around the jawline, the gentle sag that makes everything feel less defined. Because if you've been wondering how to lift and refine your lower face without surgery, my next video walks you through that.